So I'm Catherine Simonson, the Director of Child, Youth and Family Services at Howard Center. Not only am I representing Howard Center, a designated agency for Chittenden County, but I will also speak to shared concerns by the children's directors statewide in the designated agency system. Together, we represent a group that provides mental health services to over 10,000 children and adolescents through the designated agency system. To begin with, I can endorse the vision of Challenges for Change as it relates to the integrated family services component. For some time, many of us have imagined a system where both policy and funding supported services focused on the family, as opposed to an unidentified child. The operational design for the AHS Integrated Family Services also holds tremendous appeal as someone who directly deals with multiple funding streams within AHS for child and family services, with accompanying distinct paperwork and numerous auditing requirements. The siloed Medicaid streams no longer make sense, and I'm certainly in favor of simplifying the related processes. At the same time, I strongly recommend extending the timeline for implementation for many of the proposed system changes, given the magnitude of the reorganization that is proposed for child and family services. It is imperative to have more time than is provided today to engage consumers, providers, and stakeholders in order to operationalize this vision with integrity. Over the past 30 years, our state has developed an impressive system of care for children and families that's been built on partnerships across the AHS department, as well as the Department of Ed and local education agencies, LEAs. In 1988, the legislature passed Act 264 with the purpose to develop and implement a coordinated system of care for children and adolescents. Act 264 truly changed the way children and families receive care, and we moved from a departmental focus to greater integration across AHS with a focus on mental health, DCF, and education. I just feel it's important to, in moving forward, to clearly articulate the proposed steps towards transformation so impacted consumers, providers, and stakeholders can engage in the implementation and inform policymakers of the unintended consequences. And I just going forward would say that one piece that, and I know my time is running out, that I wanted to speak to is that in the Challenges for Change, there is a focus on early intervention, but want to remind policymakers of a responsibility to those children and families who require intensive services out of home. So with that, if you just keep in mind that balance with both of those needs, and thank you for your time and consideration. Thank you.